So typically hyperbaric medicine, the way I explain it to my patients is when we're talking at normal atmospheric pressure, there's a limited amount of oxygen that can get into our bloodstream. So for example, everybody's had their vital signs taken. When they come around, they put that little oxygen probe on your finger. At normal atmospheric pressure, the highest it can read is 100%. So when we put you in the chamber and we're pressurizing that chamber with 100% oxygen, then that kind of bypasses the normal mechanism and forces more oxygen into your bloodstream. So we're actually using the oxygen as a medicine. There's a series of questions before each dive to make sure that they're appropriate to go into the chamber. And then you're placed on a bed, the bed's loaded into the chamber, and once the door is closed, then we start pressurizing the chamber with 100% oxygen. It takes about 15 minutes to pressurize the chamber, and then you're under pressure or at depth for about an hour and a half, and then 15 minutes to come back to normal atmospheric pressure. Most patients, they have to go through a certain protocol before we start to consider adjunctive HBO therapy. So for example, our diabetic patients, we see a lot of diabetic foot wounds. They have to have shown that they've not showing the appropriate healing response after 30 days. At that point, then we can consider adding this type of therapy into their treatment regimen. But overall, it's been shown to decrease one's risk of having further complications, and that could include limb loss. I always tell my patients nothing's 100%, but this has been shown to be a benefit. And I'm a strong believer in this type of therapy.